My name is Katie Walker. I am the Director of Physical Therapy for Hughston Clinic Orthopaedics, and I have been a physical therapist for a little over 11 years. So I knew I wanted to be a physical therapist when I was 9 years old. My father had an accident where he was in the hospital for several months, and we watched him go from being in a coma to a fully functioning adult with the help and the guidance of physical therapists, occupational therapists, and speech therapists. The best part of my job is helping patients get better, helping patients return to their normal daily life with little to no pain. My most memorable patient was a woman who fell down the stairs and broke her ankle at 7 months pregnant. So she had surgery by one of our surgeons, and she came to see me non-weight bearing, and we had to get her fully walking by the time she had the baby. So about a week before the baby came, we had her walking out of the clinic, so it was a great experience. One of the best advances that we have as therapists are the changes in the surgeries that the surgeons perform. When they are able to use the robotics or minimally invasive, it always helps the therapist have a better outcome with the patient. I think the best advice that I could give people is just to stay active, do your exercises, go to therapy when you're in pain, and then continue doing your exercises long after you're done with therapies. The best part about Hughston is the connection that the therapists have with the doctors. We have several surgeons that will come over and talk with the therapist about specific patients. We have some surgeons that will pull the therapist into the patient room so that they can get an inclusive concept of their health and their care. We can do early access to therapy. The pathway from the patient having first doctor's visit to surgery to therapy after, it just makes for a better outcome. So we have 6 physical therapy clinics that are directly connected to the doctor's offices, which allows us to communicate with them very quickly and very easily. Some of the fun things that we have at our locations, most of our therapists are dry needle certified, which is a new advancement where the therapist can stick very tiny, very thin needles directly into the muscle, which allows the patient to leave therapy feeling better, feeling looser, having less pain. All of our clinics also have hand therapists that will come to the locations, and a fun piece about our hand therapists is they are all certified hand therapists, which is very unique because they are highly trained and highly specialized in their field.